If you're a loved one or looking into the new Alzheimer's disease therapies like Leqembi or Kisunla, you've likely heard about mandatory brain MRIs. So while common side effects include minor infusion site reactions, headaches, the main reason we order regular brain MRIs over the first 7 months of therapy comes down to a specific class effect. It's a side effect known as ARIA. ARIA stands for Amyloid-Related Imaging Abnormalities. But what actually is ARIA, and why are these scans non-negotiable? So ARIA comes in two distinct forms on an MRI, ARIA-E and ARIA-H. The first is ARIA-E, where the E stands for edema or brain swelling. Here's why it happens. Amyloid plaque doesn't just build up between brain cells, it's also embedded directly into the walls of the brain blood vessels. And when monoclonal antibody drugs quickly strip that amyloid away, it temporarily weakens the blood vessel lining. And small amounts of fluid can then leak out of the surrounding area, and that can cause some swelling in the area. So the second form is ARIA-H, where the H stands for hemorrhage, bleeding. And using that same biological mechanism, when these blood vessel walls are temporarily disrupted during plaque clearance, like microscopic drops of blood can leak into the brain tissue. On an MRI, this shows up as, we call it microbleeds or superficial siderosis, and it's small iron deposits left behind. While the word hemorrhage, bleeding, sounds alarming on the MRI, these are typically tiny microscopic spots rather than large strokes. Now, here's the most critical point that every clinician and family member needs to understand. The vast majority of ARIA cases are completely asymptomatic. So a patient can feel 100% fine, no headaches, no confusion, no vision changes, while their MRI shows active swelling or microbleeds. That is why we get these routine MRIs at regular intervals. For example, with Leqembi, scans are required before the 3rd, 5th, 7th, and 14th infusions, and Kisunla has its own early monitoring schedule. We check the brain to catch ARIA early, pause dosing if necessary, and allow the brain time to clear the swelling before resuming treatment. Other times, we may decide that this is not the right treatment for our patients and consider other modalities to treat disease. Understanding ARIA isn't about causing fear, it's about smart, proactive clinical care. Drop your questions below, and I'll keep posting information on these medications. Check out GeriAcademy for more information on pharmacology and aging.